Wellness Wednesday, sponsored by Baptist Health.
Welcome back. For years, people with AFib were told to avoid one of the world's favorite morning drinks. We're talking about coffee. But a new study suggests a daily cup may not raise risk, and it could even help. Here to break down the findings is Baptist Health cardiologist Dr. Scott Davis. Dr. Davis, good morning.
Good morning.
Okay, so for decades, Doc, the standard advice for AFib patients has been to strictly limit or abstain from caffeine. How will the results change the guidance you give your patients?
Right, so we got a new study that came out in JAMA, the Journal for American Medical Association, and the Heart Association had a big presentation looking at patients with atrial fibrillation, so the irregular heart rhythm, people on the blood thinner for it. And this study looked at 200 people with AFib or atrial fibrillation, and they divided them up, 100 and 100. And it was after they had gotten a cardioversion, so they were back in a regular rhythm. And so they had one half the group drink a cup of coffee a day, the other half completely abstained. The group that had the cup of coffee a day had a almost 40% hazard reduction in recurrent AFib week to week. So the coffee group had better results with recurrent AFib than the group that abstained. So what does this mean? It means that, number one, this is suggesting that drinking coffee is actually safe if you've got an arrhythmia or you got this atrial fibrillation. What it does not mean is, does it prevent AFib, right? That's not what this was built to study. It's not, the primary prevention concept. It doesn't mean if you drink coffee you won't get AFib. But what it's showing is that it's safe to have coffee if you have atrial fibrillation, and that, moving forward, we may need to study this a little bit more in depth. Now, it didn't look at patients that were drinking energy drinks like Monster or Red Bull. It wasn't looking at high intake caffeine, and this is also needs to be applied to the individual. There are still some folks that may notice that coffee may trigger some rhythm issues in them, right? But if you take all comers, it's showing that coffee intake is safe for this group of patients with atrial fibrillation.
Should that coffee be black, or can we put cream and sugar in it?
You can put cream and sugar in it.
Oh.
You can doctor it, as my grandmother would say. That's right. That's right.
Okay, so is there an amount that they are suggesting, for example, the maximum number of cups or the minimum?
So they looked at a cup per day, so that would be labeled as moderate caffeine intake. And again, they didn't study, folks that drank a pot of coffee a day or folks that were drinking other caffeinated beverages. They didn't look at iced tea. They didn't look at Monster energy drinks. They didn't look at Red Bulls, right? And so it was just looking at moderate caffeine intake. But the old mantra has always been, arrhythmias and rhythm disturbances and caffeine intake are tied together. This is showing the exact opposite. So it's encouraging that it's a safe thing to do to drink coffee if you have atrial fibrillation.
All right, Dr. Davis, I feel like I learned so much when you're here. I wish you were here every day.
You get continuing education.
Yes, sir. Well, thank you so much. Here is the Baptist Health information on the screen. For more info, go to baptist-health.com or call 188-BAPTIST.